where do you think the public is now in terms of understanding? If you can feel free to comment either given your background as an Australian, from an Australian perspective, or globally from your understanding through UNEP, where are we at now in terms of understanding and the awareness of the potential for adverse health impacts from a polluted and unhealthy or degraded environment, and how that impacts on human health? So basically, you know, we need a healthy environment for healthy humans. Where do you think the public is at with that one?
So again, I think it depends on where you are. So I would say in Australia, we have a really good understanding of air pollution and impacts on health, largely because we've experienced lots of fires, but also because we've had quite significant campaigns in terms of air pollution, the effects of air pollution and the effects on health. And we've got a good monitoring system where people can access information. I also think that in those countries that have extreme air pollution, like India, like Bangkok, other parts of Southeast Asia, where governments have got monitoring programs and where they provide advice to their communities to stay indoors or, you know, to make sure that they put in measures to protect themselves, again, they've got a good understanding of the relationship between the environmental drivers of, say, air pollution and other contaminants, and also then what it means for health for large parts of the world and here in Kenya. So, you know, having lived here for a couple of years, it drives me nuts because the practice for waste here is to burn it. And of course, they're burning plastics and metals and everything you can imagine. And it's a practice that occurs pretty much all the time. And people have all of these small fires, plus you've got the transport and industry. And so air pollution is a significant issue. And where I live, you know, I talk to people around there and I say, look, you know, can you please stop burning that? But why? This is our way of dealing with it. I've said, well, it would cause air pollution. So that understanding within the community is not there. So individuals may know if they've got individual health issues, but more broadly, and that's because in countries like Kenya and others in Africa, Southeast Asia, etc., they don't have jobs. They don't necessarily have clean water. And so the issues are very, very different in terms of how people live, what they have access to, and actually even just having access to information about the relationship between health issues and the environmental drivers of that. So here in Kenya, again, they've got it's the largest waste dump in the world, called Dandora. And, you know, I've been to this particular location where all of these kids congregate to learn music and to explore sports and to go to the library and things like that. And sometimes they have to close it because the air pollution coming from burning from Dandora is so significant that the kids can't stay there. So there is that level of awareness there, but more broadly, it depends on where you are. And again, that's a role that UNEP has. If we can provide information to those that need it in particular countries, particularly on something like air pollution, then governments are more likely to act, but importantly, community are more likely to act to actually stop particular practices, but then also lobby their governments for changes.
That's great. I think we're very lucky in Australia to have fairly strong public health programs and public health and education around that too.